Good day, everyone, and you are welcome to our fourth video on HLTINF006, which is Apply Basic Principle and Practice of Infection Prevention and Control. Today, we are going to be discussing how to manage blood and bodily fluid spill. Infection control, as we understand and as we've been discussing for the past few videos, it is a way of looking after ourselves and keeping ourselves safe as well as people in our care. While working in the healthcare industry, we are going to be exposed to blood as well as bodily fluid. How do we manage this? And how do we keep ourselves safe as well as our clients safe? Blood and bodily fluid or substance spills should be dealt with immediately if we identify such. Spills such should be attended to as soon as it's safe in operating room or in circumstances where medical procedures are underway. Care must be taken to thoroughly clean and dry areas where there is any possibility of bare skin contact with the surface. PPE should be used for all cleaning procedure. Dispose it of and sent for cleaning after use. And hand washing must also be conducted, and we should dry our hand appropriately after cleaning this procedure or these areas. Where spill occur on a carpet, we should shampoo it as soon as possible, and we should not use disinfectant. Steam cleaning may also be used instead of shampooing in order to get a very good outcome. And after doing such as well, we need to properly clean our hand, use hand washing procedure to complete this particular process. Reprocessing or reusable equipment or instrument. Single-use equipment. If we see symbol number 2 cross out or slash sign, it means this particular equipment is singular use. So the moment we finish using them, we should dispose them off. They must not be recycled or reused. We should know the general procedure for recycling crucial reusable material medical devices. Some of them might include cleaning thoroughly as soon as possible after use, sterilizing after cleaning by steam under pressure, sterilize through an automatic low temperature chemical sterilizing system, other liquid chemical sterilize or ethanol or ethyl oxide sterilization. Do this if the equipment is heat or moisture sensitive. Ensure critical items are sterilized between each patient. All these are what we are expected to do if we are using equipment that are reusable. The step for reprocessing semi-critical reusable medical devices are as follows. Clean thoroughly as soon as possible after use. Sterilize or steam sterilize if preferable. Use high-level TGA recommended chemical. Terminal sterilize or even medical device disinfectant. Do this if the equipment could not tolerate the steam. The two actions for reprocessing non-critical reusable medical devices are clean as necessary with disinfectant solution and disinfect with compatible low or intermediate level TGA, including sterilant or medical device disinfectant after cleaning if decontamination is necessary. All these are what is expected of us in order for us to look after our medical devices, those reusable and those that we need to, of course, clean before we use. After that, we will be talking more about the management of waste. Infection control, of course, if we don't manage our waste, it means there is likelihood of us recontaminating or even getting infection due to poor waste management. So poor waste management may ruin your infection prevention efforts. In order to stop this, we should think about storing waste contaminated in a designated area. Plastic bag must be strong enough to contain clinical waste safely. Plastic bag and mobile garbage bin must be color coded according to the organization policies and procedure and the clinical waste requirements that of course such garbage will be contained. The mobile garbage bin must have a smooth and impenetrable internal surface. The mobile garbage bin must have rigid wall resistant to rupture or even any corrosion. The mobile garbage bin must also be washable, and the mobile garbage bin must be leak resistant. All this is very, very important so that if we have any waste in any of these bags, it does not get into the environment and contaminate our environment. Collecting and transporting waste. Do the following when dealing with contaminated waste. Wear appropriate PPE when handling the contaminated waste. Never compact plastic bag that contain contaminated waste by your hand, and hold the item away from your body when handling contaminated waste. Example of the time that we are likely to be doing this might be when our clients, probably during COVID, that's if when they take off their clothes, or even if any of our clients have what they call MRSA, or the clothing or any other material that we get from them, we have to bag them appropriately, and we try not to hold them closer to our body so that we don't get infected with this. Some of the waste that can be categorized as contaminated waste include clinical waste. The clinical waste can be the human tissue. And how do we treat the human tissue? We treat this by incineration. Another contaminated waste can be contaminated sharps, recognizable anatomical body parts. Or if we have this, we should, if we are dealing with the contaminated sharps, autoclave or steam sterilization is what is required to treat such sharps or such waste. And if it has to do with the anatomical body parts, incineration is the best way to deal with it. Disposing of waste. Although general waste are separate from contaminated waste, it is best to wear the appropriate PPE, that is like your gloves, when disposing them. This protects you from dirty and microorganisms in the waste, especially when handling organic matters. Ensure that the containers are tightly sealed and without any leak before you collect them. We have different law in different states and territory in Australia. For example, the Australian Capital Territory, there is what we have the the waste disposal legislation we have there is Clinical Waste Act 1990 and the Waste Management and Resources Recovery Act 2016. While in the New South Wales, we have the Protection of Environment Operation Act 1997 number 156 and the Protection of Environment Operation Waste Regulation 2014. This goes on to different states, so it is very important that we get ourselves familiarized with our states as well as the waste disposal management or waste disposal legislation that is applicable to our state. Aseptic techniques. The 5 fundamental principles of aseptic technique are the following: sequencing, environmental control and hygiene, maintenance of aseptic field, and use of PPE. Aseptic technique, it means that we have to do everything at utmost cleaning. We should not in any way touch or even spread anything that can infect the process. So we should follow all these 5 fundamental principles at all time when we are dealing with aseptic equipment. Respond using transmission-based precaution or enhanced cleaning. Standard precaution are steps that are undertaken regardless of the infection status. So if an infection epidemic is proven or probable, more precaution must be taken. 2 of these additional precautions are as follows. We have the enhanced cleaning and the transmission-based precaution. While using enhanced cleaning, as we all know, or as we've all observed during COVID, we require to do even more cleaning than we used to do. This is an example of enhanced cleaning. Be familiar with your organization enhanced cleaning policies and procedures such as the following. 1. Require tasks for enhanced cleaning, schedule of enhanced cleaning, frequency of the enhanced cleaning, space that require cleaning and disinfection, the roles and responsibility of people that are expected to carry out this enhanced cleaning. As I said earlier, during COVID, normal cleaning that we do probably once in a day, we have to do it like 3 or 4 times depending on the situation in which the organization is going through at that time. This is an example of enhanced cleaning. And all the high traffic area, for example, the rail, the desk, the laptop, all these are some of the equipment that we provide this enhanced cleaning for during COVID. This is where we are going to be stopping our recording today, and thank you all for joining. I'll see you next time. Bye for now.